Okay, are there any other complications that maybe you want to mention in this video?
I think we should talk about capsular contracture. That's one of the more common long-term complications. It can happen in at least 2 to 5% of patients.
Okay.
And again, this is one of those problems that you don't know ahead of time who it may develop in. It'll most commonly start to develop in the first 3 months and become noticeable.
Okay.
Technically, it's a lifetime risk. Every implant has a capsule around it. It's a soft lining. It wants to be roomy and soft so the implant can feel good and look good. But for reasons that aren't entirely clear to us, but partially clear, that capsule can constrict around the implant to any degree. And the more it contracts around the implant, the more firm the implant becomes, the rounder it becomes because it's being compressed into a small space. That will draw the implant up out of position typically, and it can even become painful. There's different degrees of how bad the capsular contracture is. Now, to try and correct a capsular contracture requires surgery. We need to either move the implant from behind the muscle to in front of the muscle. And since typically we're behind the muscle to begin with, we don't move it back in front. Or we need to remove all the scar tissue, all that capsule, and change the implant to a new implant so that we have a chance to form a new capsule with completely normal tissue around. Because if we leave old capsule there and the rest of it is new, it's like that old capsule will cause that new capsule, in a lot of instances, to start contracting, and you'll get a recurrent capsular contracture.
That makes sense. Well, thank you so much for explaining for everyone out there, including myself, who was unsure about what that phrase even meant. That's very helpful, and we hope to see you in more interviews in the coming videos. Thank you so much, Dr. Hunsaker.
Thank you.